Alright, I'm going to be doing a mini bag, medication via a mini bag today, and right now I'm going to be in the med room getting my meds ready. My doctor's order is vancomycin, 250 milligrams of Vanco in a 100 milliliter 9% sodium chloride solution to infuse over 1 hour at a rate of 17 drops per minute. And there's my work, right there. And it's for bacterial infection of the intestines because he had peritonitis. Nausea, and dizziness, tendinitis, and hearing loss are the side effects. The adverse reaction is a rash, itching, swelling, swelling of the hands, face, and neck, dizziness, and respiratory issues. It does not work well with aminoglycosides, amphotericin B, and some other antibiotics. And anesthesia is not something you want to do it with either. Okay, gonna keep that with me while I go into the room. But now I'm in the med room. I've cleaned my hands, washed them, all good. I have my vancomycin bottle. The date's good. All right. I got my needle. I need to draw up, and my med is 250 milligrams per 2 mLs. So I got my syringe. I'm gonna open up my needle. And do that. Remove the cap. Be very careful. I want to drop 2 mils of air into my needle. Stabilize my bottle. Insert my needle. Secure my syringe. Insert my air. I flip my bottle. I'm going to drop 2 mils of solution. Making sure all the air bubbles are out of it. Doesn't work right. Okay. Too many air bubbles. Let's try that again. A little slower pull. And 2 mils. Going to flip back over. Draw it out. Going to cap my syringe. Remove my needle, and I have it ready. I have a blunt cannula, so it's needleless whenever I go into the room. And I should have cleaned my bottle before I withdrew my medication. Should have done that, and I'm going to drop this into the sharps bin. It's in the sharps. I'm going to clean out my area and get my medication, my MAR, and my doctor's orders, my medication, my bottle, my blunt cannula, and we're going to go into our patient's room. And on the way, I'm going to stop and get my supplies to do this. I'm going to need a medication label for the bag, the drip set, a 100 ml bag, and I'm going to need a flush, actually 2 flushes, and some alcohol wipes. Got them. So we're going to go into our patient's room. I'm going to address my patient. Hi, how are you? Okay, can you give me your name and your date of birth? Any allergies? Okay. And I'm going to check their IV site first. IV site looks good. There's no infiltration or anything that I can see of. There's no irritation or phlebitis. Okay. I'm going to step back a second, use the bedside table. I'm going to verify my order once more. And double check. I have my bottle and everything with me. I'm going to prep my medication. I'm going to open up my bag. Okay, got my bag. I'm going to open up my drip set. Maybe. Got my drip set. All open. That can go in the trash. I'm going to check my set, get it all untangled. Careful not to stick myself with it. Okay. I'm going to hold one end. I'm going to have the poker with the other end. I'm going to have my bag. Pop my knee, pop that. Pop that. Go into my bag. Alright. And I'm first going to lock that before administer my medication into the bag. Get my blunt cannula and my medication. I'm going to attach the cannula, pull it out. Alright. And I'm going to go into the bag and push my med. Nope, this is a needled. This is for a needle bag. So I'm going to take that off and get my needle, which I should have had anyway. Got my needle. I'm going to clean my port this time. Clean my port. Throw that away. And into my bag. I'm just slowly pushing my med. Is not to break the bag. Okay. All done. And this will go in sharps. And it's in the sharps container over there. Okay. And now I got my medication label. Has my patient name, my room number, the drug vancomycin, the amount 250 milligrams added by me, Dawson Taylor, in a solution of normal saline, 0.9% sodium chloride, on today's date, 9/2/15, at time 12:25, and my start time is going to be whenever I throw it in, hang it up there. I'll add that, which will probably be 12:30, and my rate's going to be 17 drops per hour because it's going to run for 1 hour. It'll be done about 13:30. And now I'm going to affix my label. Put my label on the bag. And on the bag, there it is, all connected. Now I'm going to prime my tubing. My chamber is full. I'm going to slowly release that. And I'm going to hang my bag on my IV pole. Okay. My bag is hung. And it's starting to run. There we go. Gonna clamp it back. There we go. I have that ready. Just gonna lay it right here in front of me so I have it whenever I go to do that for my patient. Now I'm going to get my tubing right next to my patient. I'm gonna wash my hands again, put clean gloves on. Here's my gloves. Okay, and now we're at the patient's bedside. I've already identified my patient. I'm going to do it again just for sure, good measure. Hi, what's your name? What's your date of birth? Any allergies? And his IV site is still patent. There's no infiltration. Looks good. Is it tender? Does it hurt any? No? Okay. I have my flush and my alcohol prep. Going to use the ASASH technique. So I'm first going to clean my port. Clean my port, going to keep that close. And I'm going to attach that. Gotta move the tape a little. Get a little high strung on the tape. There we go. I'm going to attach that. I'm going to get ready to push. And I'm going to unclamp and gently flush with 3 mils of saline. It's going good, nice and easy. Okay. I'm going to, there's no infiltration, there's no, does it hurt? No, there's no heat to it. Okay, so now I'm going to, while I'm still pushing kind of slowly, I'm going to clamp my IV back. There we go. Disconnect that. And I'm going to dry that out once. I'm actually going to hold that there with my alcohol pad. I'm going to uncap my IV tubing. Not going to work very well. There we go. Unclamped. It's ready. My site, my connection's good. I'm going to attach my connection. And I'm going to unroll the infusion clamp. I'm going to now observe the site. It's flowing good. Tube's really long, takes a minute to get going, and it's going. Now I'm going to observe my chamber and count it for 1 minute to make sure it is flowing at our 17 drops per minute, so it infuses over the right time. And it is going pretty good. And it's been a minute. It's dropping at 17 drops per minute. And now I'm going to continually watch him, clean my area every now and then, come back over the next hour, make sure it's flowing right, make sure it didn't infiltrate, check on him. 15 minutes, I am definitely going to come back to see his reaction to the medication. And now we're back in the room. It's been an hour. I'm going to identify my patient. Hi, how are you? How'd you do? Is your IV site hurting? Okay. Can you give me your name and your date of birth? Okay, and still no allergies that we know of? Okay. Now, since your med's good, we're going to get our stuff ready, which I already have ready, some alcohol pads and a flush. Okay. I'm going to clamp off my IV because it's been an hour. Bags just is empty. Gonna clamp that off. Got my alcohol pad ready. And I'm going to undo my site. Kind of stiff. There we go. Lay that off to the side. Don't get us or the patient wet. Clean my area. I'm going to use the ASASH technique. I'm actually going to aspirate, push a little bit of saline, administer. Now, I'm going to use the push stop method, which I'm going to push half a ml of saline, stop, push another half ml of saline, stop, and continue going until I've done 3 mils. So I'm going to do this about 6 times. Okay, and that's still good. And my H for heparin for the ASASH technique is whenever using heparin, I'm going to flush the line with as much saline as needed. And I'm clamping my line back off, removing my flush, and making sure it's taped down good, and it is. I'm going to dispose of everything, and we should be good. And just going to make sure my needle went into the sharps container, even though it already did. Shouldn't be there. That was an hour ago. And his site's still good. He handled the medication good. And now I'm going to document the medication that I did, the time, the infusion rate that it went over, the dose, and the route, which was his right arm. And going to state my condition of the IV site. It is unchanged. There's no infiltration, and it is patent. I'm going to record the volume of fluid he has, 100 mils, plus about 12 cc's from the flushes. All right.